Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Ryan Schnetzer. He's a board-certified orthopedic surgeon and also fellowship trained in spine surgery. Today we're going to talk about his practice in Central Georgia. Dr. Schnetzer, thanks so much for being with me.
Oh, thank you so much for having us. It's a pleasure to be here.
Thank you. Would you let our viewers know a little bit about the training that you received to become an orthopedic surgeon and then to focus on spine?
Yeah, so obviously it starts with medical school. So your 4 years of medical school, and your last year of medical school, you apply for residency programs. I did my residency in orthopedic surgery, which was a 5-year program at the University of Florida in Gainesville. And then from there, I did another specialty fellowship training at the University of Wisconsin in Madison.
And what attracted you to working with orthopedics, but particularly about the spine?
I think just the complexity and the nuances of dealing with the spine and dealing with the patients that have spine conditions. There's a lot of thought that has to go into it and trying to isolate, which nerve's being pinched, where the issue is coming from, and then the multitude of options to treat it.
When we talk to people about back pain, they may be experiencing pain maybe in their arms or legs, but that could be coming from the spine. How does that transfer?
Correct. A lot of the people that end up being referred to our clinic come in complaining of pain that's going down their arm or going down their leg. And they'll have pain with numbness and tingling, and they come to us and they say, well, my back's not hurting or my neck's not hurting. And what we have to explain to them and show them on their MRIs and their imaging that it's the nerve that's being pinched in their neck or their back, and then but yet they're feeling the pain that's going down the arm or down the leg where that nerve runs.
When someone comes in and they have that kind of pain, what's the visit like as you progress towards maybe a procedure?
Well, typically the first time they see us, depending on how much they've already had treatment-wise, we like to begin very conservatively, start them on some oral medications, get them in some physical therapy. The majority of the stuff we see will get better with a little bit of time, physical therapy, and some anti-inflammatories within a couple weeks.
And for patients who do need treatment, what are the types of options that you offer, the technologies you use in surgery?
Yeah, that's one thing that has really changed, especially in spine surgery over the last several years. There's been a lot of new things that have come out, a lot of newer ways to take care of things that are a lot more minimally invasive. We have the ability to use the Mazor robot, which has really helped, one, with correct placement of hardware when we have to put that in, but also help use smaller incisions and get people back on their feet faster.
When you talk about the Mazor, we have had some shows about scoliosis. Can you talk a little bit about the work you do with children?
Yeah, a fairly substantial part of my practice is doing pediatric scoliosis surgery, and that's in adolescent kids that come in that have pretty significant deformities or curvatures of their spine. They come into us, and a lot of times it's a fairly visible deformity, and we're able to do with using the robot and using the spine hardware to get them, if not perfectly straight, almost significantly straighter than where they were when they came in. And the main thing is preventing it from getting worse as they get older. When is a child
normally, when is that normally detected in children? Is that something that their pediatrician normally sees or parents see?
It can come from anywhere. There's very early onset scoliosis that we see in young children, 2 and 3 years old. Most times you notice it around when they're reaching puberty. They usually have a smaller curve, then as they hit their growth spurt during puberty, the curve becomes much more pronounced.
So shifting gears to adults, as we age, of course our bones are also aging. What are some of the ways that Ortho Georgia is addressing bone health?
Well, one of the main things that we've done as a group at Ortho Georgia is we've started a bone health clinic. And the main purpose of this clinic is to manage people with osteoporosis, to try to prevent them from having osteoporotic either compression fractures where they have spine fractures or hip fractures or even wrist fractures.
So tell us, when someone's going through that, are they getting medication normally? I guess it's something, physical therapy also to make them aware of how their bones are aging?
Well, certainly it's some physical therapy. The first thing we have to do is get a bone density scan to see, how weak their bones are. And depending on where they fall on a World Health Index risk assessment will depend on if it's treatment with just basic over-the-counter medications, supplements, vitamin D or calcium, versus needing prescription medication.
So for others who are interested in bone health or taking care of their spine, what are some things you talk to your patients about for spine health?
The main thing to try to prevent having back pain and try to keep a healthy back is staying active, keep your flexibility, The last thing we need to do is sit on the couch eating potato chips. We need to be up and moving, and I know it's counterintuitive when you have back pain to get up and move, but doing that and staying active, keeping your core muscles strong and staying limber helps take some of the load off of your back.
How long do you think somebody should wait before they seek professional treatment for back pain?
I think if you've had back pain that's been going on for more than 2 weeks, fairly consistent, I think it's time to seek some help.
And what would you say to people regarding their weight, a healthy weight, and making sure, how does that affect your back?
Obviously, maintaining a healthy weight is going to help with degenerative conditions. As we get older, our spine does wear out just like hips and knees. So, keeping a healthy lifestyle and keeping a more normal weight can help take some of the pressure off of your back.
So if someone watching today sees a condition in themselves that you've described, what's the best way for patients to get in touch with you?
I think the best way is just to give our office a call. We have 4 spine surgeons at Ortho Georgia. We can all take care of any condition that shows up. So give us a call and we can get you in, or you can go through your primary care, either way.
Well, thanks so much for telling us more about your practice.
All right, thank you.
And thank you for joining us at Atrium Health Navicent Knows Health. Please visit us at atriumhealthnavicent.org.